EMDR therapy was developed by Francine Shapiro, PhD. The EM stands for eye movement, and the DR stands for desensitization and reprocessing. What makes EMDR therapy unique is that it uses the eye movements to facilitate the desensitization and reprocessing. Those are elements found in every trauma therapy. There are 30 years of research supporting the efficacy of EMDR, so it's not surprising that it's a gold standard evidence-based practice for the treatment of PTSD. EMDR is recommended by the World Health Organization, by the Veterans Administration, the U.S. Department of Defense, and many other organizations globally that oversee trauma treatment. EMDR is practiced around the world and has helped millions of people to date. An evidence-based therapy is simply a therapy that has a research base showing its efficacy. The research shows that EMDR and prolonged exposure are both equally effective and superior to other trauma treatments. And when compared to prolonged exposure, EMDR is much more easily tolerated. You don't have to write out your trauma narrative. You don't have to go home and read it. There's no homework. So it's not surprising that people have a higher completion rate and a lower dropout rate with EMDR. So EMDR is the most robust research shows that it's extremely effective for PTSD. But there are also research lines about EMDR for anxiety, for depression, for dissociation, and especially for addictions. Lots of people are excited about that. EMDR can really work well with all kinds of trauma, for example, natural disasters or accidents or surgeries, diseases, interpersonal violence, domestic violence, childhood abuse, all different kinds. It works really well. And it's also appropriate for people of all ages. So trauma therapy can bring up some really difficult emotions. So we want to focus first on stability. So at Valley Cities, if you're interested in EMDR, you tell your case manager or your clinician, and then we do something called a therapy assessment. So we're going to go through and talk to you and read your chart to understand how stable your life is. Are you, for example, homeless? Are there stability factors in your outer life, like homelessness? And then how stable are you within yourself? So do your emotions run away with you? Or how capable are you of managing your emotions, or managing stress, or making decisions, or communicating with people? Do you have a gambling problem or spending too much money or things like that? We just want to ensure stability. So sometimes first we recommend that people go through some skills training to become more resilient and more hardy, and then transfer to doing trauma therapy. Other people, so some people do that first and then transfer to trauma therapy, and other people go directly to EMDR and trauma therapy. So when you are referred for trauma therapy, then we take a very minute history. What are the things that happened to you? How old were you? How did that impact you? Is that still affecting you today? And then we develop a target list from that and go through those targets with EMDR. The EMDR clinician is not your forever clinician. After EMDR is finished, then people usually return to a previous clinician or go to someone else to work on additional therapy goals. So that's an important question. So at the core of all of the research is the standard EMDR protocol. And a protocol is just step A, B, C, D, E, F in that order. And so we want to train people to learn and practice EMDR with that order of things, step A, B, C, D, E, F in that order. And so we train all our people through approved channels of training through EMDRIA, basically, the EMDR international association, so our people go through approved trainings. And then there's the possibility for professional development for staff, and I'm really excited about this. People can learn to practice EMDR if they're not hired. Practicing EMDR you can learn, and you can also work towards certification in EMDR. So there's just tremendous opportunity in professional development and growth at Valley City with EMDR.